Hello guys, welcome back to Medico Days. So today I've gathered few more questions of the Inicet May 2025 recall session. This I have prepared today after my duty, and I could only prepare few of the questions, but yeah, let's look at those questions. First one from the OBG. According to modified Rotterdam criteria, which are the criteria for diagnosing PCOS? So here the answer is delayed menstruation and hirsutism. The Rotterdam's criteria is an important question from Neetpg, and from Inicet point of view, Rotterdam criteria requires at least two of the following three features for diagnosing PCOS. Those are oligo or anovulation, and second one is clinical or biochemical hyperandrogenism, features like hirsutism, acne or elevated androgen levels, and polycystic ovaries on ultrasound. Next question, which of the following does not cause fetal bradycardia? Answer is maternal fever. Fetal bradycardia is caused by hypoxia, cord compression or placental insufficiency, and maternal fever increases the maternal and fetal metabolic rate, leading to fetal tachycardia and not bradycardia. Next question, the uterine stimulant not to be given in the management of PPH is? Answer dinoprostone. So the different types of prostaglandins, the prostaglandin E1, F2, E2, all those and their importance are recently being asked in Neetpg and Inicet, important topics. Next question, this is the laparoscopic image of a patient with infertility and delayed cycles with free flow on chromotubation. What is the probable diagnosis? So a person with delayed cycles, infertility, and also anovulation, all these points towards features of PCOS, and it is mainly because of hormonal imbalance. So PCOS is the answer here. Next question, an asymptomatic 29-year-old pregnant woman presents in the first trimester with urine culture showing E. coli. Most common complication associated is? Answer preterm labor, because asymptomatic bacteriuria in pregnancy caused by pathogens like E. coli is not treated in 20 to 40% cases, leading to complications, and it can ascend up and cause pyelonephritis or systemic inflammation as well. Next question, arrange in the correct sequence of the steps of taking pap smear. So answer is lithotomy position, pap smear taking, and lithotomy position, perspeculum examination, and then take the sample. So next question, remaining OBG questions are already discussed in patho, pharma and micro. Few more questions are discussed, and then those questions are like the adnexal mass with abdominal caking and elevated CA125. So differentials include mucinous or serous ovarian tumors or Meigs syndrome. And the second question which was discussed previously was cervical cancer linked to high risk HPV types 16 and 18, and third one is inhibin as a marker and Collexner bodies on histologies such as granulosa cell tumor. And fourth one is dinoprostone, prostaglandin E2 is contraindicated in postpartum hemorrhage. Now moving on to ENT questions. Which of the following is incorrect regarding juvenile angiofibroma? Answer is biopsy done under local anesthesia. It is contraindicated because of the tumor's rich vascularity, which poses a high risk of severe hemorrhage. Next question, in which of the following condition is a cochlear implant not indicated? Answer is otosclerosis and fixed malleus. Next question, which of the following are causes of stridor in a newborn? So laryngomalacia and subglottic stenosis, they cause stridor. Laryngomalacia is the most common cause of stridor in newborns. It results from floppy immature laryngeal tissues that collapse inwards during inspiration, creating a high-pitched sound. And subglottic stenosis is congenital narrowing of the subglottic airway, leading to noisy breathing due to restricted airflow. Next question, which nerve is damaged if a fishbone injures the piriform fossa? Answer is internal laryngeal nerve, which will be damaged. Next question, a patient experiences vertigo and vomiting when turning in bed. Which condition is most likely? Answer is vestibular neuritis. It is characterized by acute prolonged vertigo with severe nausea or vomiting, often triggered by head movement. While positional changes may exacerbate symptoms, the primary cause is viral inflammation of the vestibular nerve. Next question, after an ear infection, a child developed limb spasms and difficulty in opening the mouth. Which condition is most likely? So answer is meningitis. It is listed as the answer, though this choice is clinically atypical for the described but limb spasms and difficulty in mouth opening. And at the most correct answer here would be from the options would be meningitis itself, if the options provided were like this. And moving on to dermatology questions, a patient presents with progressive asymptomatic neglection and no systemic involvement, which investigation should be performed? So it's a multiple correct answer question, and the answer is skin biopsy and chest x-ray. So gold standard for diagnosing the etiology of a progressive neglection is skin biopsy and chest x-ray. TB workup, particularly scrofula, that is cervical lymphadenitis, can present as an isolated negletion without systemic symptoms. Next question, a patient presents with a history of transient genital ulcer 2 weeks ago and now has lesions on palms and soles. Which investigation is most appropriate to diagnose the disease? Answer is serology, because in secondary syphilis there will be transient genital ulcer chancre, classic for primary syphilis, and there will be palmar or plantar lesions characteristic of secondary syphilis, and this progression is pathognomonic for syphilis caused by Treponema pallidum. Next question, which of the following are local side effects of topical steroids? And there is multiple correct answer. Answer is atrophy, acneiform eruptions, and hypertrichosis, which are side effects of topical steroids. Also, there can be bluish. Other two options are not the correct answer here, because they are not corticosteroid side effects. They are seen with bluish discoloration is seen with amiodarone or minocycline, and alopecia cerebellum. It is localized hair loss. It is a typographical error, likely meant alopecia. So alopecia is localized hair loss which can occur with steroids, but cerebellum, that term won't match here properly. Next, which of the following statements about skin anatomy and embryology are correct? Answer is epidermis can regenerate from hair bulb and sebaceous glands. Second one, stratum corneum is the outermost cellular layer, and epidermis is ectoderm in origin. So all these three are correct answer. Next question, which is the most common manifestation in SLE? Answer is arthralgia or myalgia. And so that's it, guys. You can go through I've put the detailed explanation, not a big explanation but a brief explanation with the questions which I have tried to cover. So that's it, guys. Hope I have conveyed a good message to you all. Until I come back with a new video, stay tuned. Till then, bye.